Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. We are back for another episode, but last week we discussed midwifery with guest Dr. Nathan Riley. That one was a really awesome episode, so make sure you take a listen to that. And now let's dive into this week's episode. So what is PCOS? Polycystic Ovarian Syndrome, or PCOS, is a condition that affects women's hormones. It affects 8 to 13% of women of reproductive age worldwide, and up to 70% of these women go undiagnosed. It is a common condition that I see in practice that women will come to me with, and also I have diagnosed them with. A lot of the women that come to me saying that they have PCOS aren't really even sure why they have PCOS or what it even means or how they even got to the diagnosis. And what's unfortunate is a lot of these women are just given this diagnosis when in fact it really isn't PCOS. So that's why I wanted to dive into this topic today so that you can be more educated around PCOS, and maybe if you're experiencing some of the things we'll talk about, you might truly have PCOS. So what are some symptoms? Well, first you could have some irregularities with your menstruation or even no menstruation. And this is usually due to ovulation. Most women with PCOS do not ovulate. And so if you don't ovulate, you don't make progesterone. And progesterone is a very helpful hormone for regulating our menstrual cycles. You might have some weight gain or even be obese. You might be experiencing some hair growth or what's called hirsutism. That can be on your face, your chest, your abdomen, what I like to call unwanted hair growth. The rogue hair here and there isn't really too troublesome, but if you're getting lip hair, chin hair, nipple hair, belly button hair, this is a little bit more of a abnormality that's probably a hormone imbalance. And on the flip side, you might actually have some hair loss with PCOS. You might feel tired. Acne can be a component of PCOS, oily skin. These thick, dark skin patches that are called acanthosis nigricans. So that's the fancy term for it. But if you have dark, thin skin patches on your skin, then this is a sign of PCOS. Multiple fluid-filled sacs in your ovaries. These are actually the cysts themselves on your ovaries. Polycystic means multiple cysts. And then infertility is a big sign of PCOS. So how is PCOS diagnosed? Like what I mentioned in the beginning is that a lot of times women come to me with this diagnosis and they're not even sure how they were diagnosed or really how they got to that conclusion. So you must have 2 out of the following 3 criteria to be diagnosed with PCOS. First is hypoandrogenism, which means you have high androgens, mainly testosterone and or DHEA. These are our male hormones. These particular hormones are more commonly elevated in men. They can cause hair growth in the unwanted places on women and oftentimes male pattern baldness too. So high androgens can cause those. It can also cause acne, oily skin, etc. The second criteria would be ovulatory dysfunction. So anovulation, or the absence of ovulation, is defined as fewer than 10 menstrual cycles a year or cycles that are actually 35 days or longer. So this can have an effect on the irregularity of the menstrual period, likely due to not ovulating. So you can still have regular cycles every month, but if they're longer than 35 days, each time they come around, so your day one was today and you don't get another period for 35 days, that's a cycle. This could indicate PCOS. And then, of course, the criteria of having the polycystic ovaries. So presence of 12 or more follicles in each ovary, measuring 2 to 9 millimeters in diameter, and or increased ovarian volume. So over 10 mils is how they diagnose the polycystic ovaries. There's actually a few different types of PCOS as well. And few different resources can say different things, but I'm going to go over type A through D, which is mainly about those 3 different criteria that we saw. So you can have delayed ovulation, high androgens, and polycystic ovaries on the ultrasound. So you can have all 3 of them. You can also have delayed ovulation, the high androgens, but you have no normal ovaries, which seems crazy because you're diagnosed with polycystic ovarian syndrome and you have no cysts on your ovaries, but it is possible. You could also have type C, which is high androgens, the cysts on the ovaries, but you actually ovulate regularly. Or type D is you have the delayed ovulation, you have the polycystic ovaries on your ultrasound, but your androgens are completely normal. This is probably, I would say, the most common one I see is, we have an issue with ovulation, androgens are low, but we also have the cysts on the ovaries. And if I don't know, or if they haven't had an ultrasound, then we'll definitely order that ultrasound for them to find out, if there's multiple cysts on the ovaries. So if you think you have PCOS, what tests should you ask your doctor for? Well, lots of them. We want to test our blood sugar or fasting insulin. This plays a huge role in PCOS and obesity and the weight gain and possibly the androgen status of your hormones. You want to ask for a full hormone panel. So your estrogens, your ovarian function of luteinizing hormone, follicular stimulating hormone, LH or FSH, progesterone, your androgens, your DHEA sulfate, testosterone free and total. And then you also want to ask for sex hormone binding globulin. That one can see how much hormone is actually bound or stuck and that we need to work to free up. Anti-Müllerian hormone is another good one for follicle status and how, quote unquote, fertile you can be. But this test is super pricey, so be mindful of that. And then you also should ask for a transvaginal ultrasound or pelvic ultrasound, if indicated, and that will give us the diagnosis if we have the cysts on the ovaries. So make sure you have your labs tested about 7 to 10 days after ovulation. Now, if you have no idea when you ovulate, aim for like cycle day 19, 20, 21 of your menstrual cycle. You can even push that out a few more days if you are having those 30-ish, days of length of your menstrual cycle. But we really want to time most of these hormones with our menstrual cycle on that luteal phase of the cycle to get the best representation of the hormones. So what can you do if you have PCOS? Well, the most common conventional treatment is metformin, which actually does really nothing to really treat the cause. It's only a Band-Aid. So metformin is treated or used for type 2 diabetes. Now, I don't clinically commonly see a connection between type 2 diabetes and PCOS. It can be possible if we have the weight gain and the obesity factor, but not always. I would say most of my patients don't have any issues with blood sugar when it comes to PCOS. So they have this treatment for metformin, but that comes with side effects. A lot of GI upset, diarrhea, etc. And it's really not fixing anything like I mentioned. So here are some steps that you can take to actually reverse your PCOS. And yes, you can reverse it, which is another mind-blowing statement that I make, that a lot of women think that they just have PCOS and they're just going to be stuck with PCOS. But no, you can reverse it. We can work on the hormones. We can work on the ovulation. We can work on these things that I'm going to mention here. So first, we need to treat the gut. The best way to do this is to clean up the diet. So we really want to reduce our inflammatory foods like gluten, dairy, sugar, processed foods, alcohol, because these foods are super inflammatory, and inflammation drives PCOS and can make your symptoms worse. You can even consider a food sensitivity test to see which foods you are sensitive to, and then begin an elimination diet. So what that means is you take the test, you get your results, you see all the foods you're reactive to, you take them out of your diet, you do not eat them for 8 to 10 weeks, even longer, maybe 12 weeks is really what I recommend, and then you can add them in one by one to see how your body responds. If you need a food sensitivity test, we have those on our website on hopenaturalhealth.com. You can get the test kit sent directly to your house. So a really good way to figure out what you're sensitive to, because those foods that you are sensitive to are also creating some inflammation in the gut, which is therefore driving worsening symptoms of PCOS. Second, we want to support our stress. But let's face it, we all have stress. It's really unavoidable, but what's important is how we manage it. So if you're perpetually stressed out, this is likely affecting your cortisol levels, which is our stress hormone. And cortisol can cause insulin to rise, which therefore causes our androgens to rise, the DHEA and the testosterone. So now we have all this weight gain and acne, in addition to feeling burnt out and fatigued. So this can also lead to anxiety and depression. So it's this nice little domino effect that can happen if we do not manage the stress. It's crazy how many women out there do not know what they do to manage stress. I ask on a scale of 1 to 10, your stress levels, 10 being the most. You can ask yourself that right now. You know, if it's upwards of 7, 8, or 9, that's pretty high significant stress. But then I follow it up with, what do you do to manage your stress? And I would say most of these women, they're like, I don't know. I don't. So that's where we need to really focus on, is managing the stress. Thirdly, we want to create a healthy environment. So get rid of the junk. The next time you need a new detergent, dish soap, shampoo, toothpaste, soap, makeup, take a look at your ingredients. So a good reference for this would be Think Dirty. There's a great app that they have, the Environmental Working Group, or Yucca. Those are all, Think Dirty and Yucca are 2 apps that you can have on your phone. And then the Environmental Working Group is a really good resource just to research some clean products. Many chemicals can influence our hormones in a negative way, so it's super important to be aware of what we are putting on our body and even what we inhale. Eat a balanced diet. So make sure we're getting protein, fat, fiber at each meal. If you eat foods that are high in carbs, which actually carbohydrates are sugar, you're only going to spike your blood sugar, which leads to a crash later on, and it's further damaging those hormones. And then make sure you're getting good, healthy fats. Not all fats are bad fats. Aim for foods like avocados, nuts, grass-fed butter, olive oil, and even fiber. We need the fiber because that's super important for our gut, our liver, and our hormone metabolism. And most of your fiber should come from vegetables, fruits, and beans. Beans are my favorite source of fiber. And my last tip is know that you're not alone. It's estimated that 1 in every 10 women is diagnosed with PCOS, and it's actually the most common cause of infertility in the United States. So it can be treated, though. We just need to figure out what the root cause is. So if you don't know where to begin, I highly recommend searching for a naturopathic doctor or functional medicine doctor in your area that can help with PCOS. I'm always here to help you. You can always book an appointment with me. But this is a condition that is, like I mentioned in the beginning, 70% of women go undiagnosed with this, and it's super easy to treat. We just need to find the driving factors and address them. So I hope this was helpful. If you're suffering or think you might have PCOS, again, know that you're not alone. There's help. We just, again, need to figure out the cause, and I'm here to help you with that. I look forward to seeing you all again next week.